The following is a presentation of the Nashville Health Care Council and Nashville Public Television.
Dan Buettner is the founder and the author of Blue Zones, and he's made a career out of studying those around the world who live long, productive lives. And he's even implemented what he's learned around the world in the U.S. in a town called Albert Lea, Minnesota, and he's going to share with you today the transformation that's taken place there. He is a longevity expert, and he's appeared on the Oprah Winfrey Show, Good Morning America, the Today Show, ABC World News, CBS The Early Show, the Dr. Oz Show, CNN, the list goes on. You're all given a book this morning when you checked in, and it has plenty of lessons about living a longer, more productive life. And although those lessons are not specifically from here in Nashville, just as you heard about the purpose of others, much that we can learn from those different lessons learned. It is a great privilege and an honor for me to introduce to you Dan Buettner, here to share his life's work around longevity. Dan?
Well, it would be my luck that I'd have to follow a speaker who makes you want to drop everything and go find your meaning before lunch. Dan, thank you for inviting me here. Thank you especially for that great introduction. It makes up a little bit for my lunch with my mother on Saturday, who essentially said, when are you going to snap out of it and get a real job? I'm going to talk today about the best practices in longevity and well-being from around the world. And I'm also going to present to you a model that might give Nashville something to think about in raising its own life expectancy and also its level of well-being. Something called the Danish Twin Study established that only about 20% of how long the average person lives is dictated by their genes. It's a little bit more for well-being. It's about 30% for well-being. But nevertheless, the lion's share of how long we live and how well we live is dictated by us. So the whole premise of Blue Zones is if we can go out and find places where people live measurably longer and measurably happier and distill down what we do, we can come back with a de facto formula for longevity. Our way for doing that was to team up with National Geographic and the National Institute on Aging and to find demographically confirmed areas where people live measurably longer. And then hire a world-class team of experts who can go to those places and find the common denominators, the cross-cultural distillation that explains this longevity and this well-being. People ask me, well, you know, they tell me, if I lived on an island in Sardinia or in the South Pacific, I wouldn't be stressed. That's false. These people in Blue Zones, they worry about their kids, they worry about their health, they worry about their finances. The main things that stress us out, these people are stressed out about too. The difference between them and a lot of us is they have little techniques to shed that stress, to downshift, as we call it. How do they do it? Well, the Adventists and the Sardinians do it through prayer. The Okinawans do it through meditation and something they call ancestor veneration, reminding themselves daily that they're not a point in time, but part of a continuum. The Icarians in Greece, they take a nap. We know people who take a nap 5 days a week, just 20 minutes, they have 30% lower rates of cardiovascular disease. Or like the Sardinians, they do some version of a happy hour. I think happy hour is actually a very powerful tool to raise your life expectancy, because not only do you downshift, so to speak, we're rarely stressed at happy hour, at least I'm not, but they also build that social network and they drink a little wine, which we all know is good for you. They have a sense of purpose. To Roy's point, I think he made a very powerful point, and I think the fact that Roy led off this conversation today is very powerful, because I think America looks at the wrong things when it comes to living longer and better. We tend to focus on diet and exercise, and I will tell you the secret doesn't lie there. Once you know your sense of purpose, the right behaviors ensue, and there also happen to often be healthy behaviors. You know the 2 most dangerous years of your life? 2 most dangerous years of your life are the year you're born, because infant mortality, can't do much about that. But the second most dangerous year in your life is the year you retire. The year you retire. Why is that so dangerous? There's a 3-fold spike in mortality that year. Could be because of the lame party. But it's probably because all of a sudden you've had a reason to wake up every morning and go to work. And that's what's gotten you out of bed. But all of a sudden that's gone. Why do you get up in the morning? What keeps you fit? Why do you keep taking your medicines? Why do you make the effort to eat right? Why do you make the effort to be engaged? It's so important for the rest of us to identify our sense of purpose at middle age. Now, not when we retire, but have that non-work sense of purpose now. I think if you can articulate that right now, and there's very good research to back this up, if you know your ikigai, why you wake up in the morning, it's worth about 7 good years of life expectancy. Very good research out of Duke and Harvard that show that people who have a strong sense of purpose have lower rates of cardiovascular disease, lower BMIs. It's something that works that we rarely pay attention to. So if we can figure out how to help people find their own sense of purpose, we give them a powerful tool in their toolbox for longevity. When it comes to eating, you'll never hear the Blue Zone diet. Most of the time, if people are trying to sell you a diet, they're reaching their hand in your pocket. They're not going to do anything for your long-term health. People in the Blue Zone eat wisely. They drink a little bit, but not too much. We know that moderate drinkers outlive non-drinkers. But part of the secret is in not only what you drink, but how much you drink and how you drink it. In Blue Zones around the world, the average person, except for the Adventists, drinks about 2 drinks a day. And no, you can't save up all week and have 14 on Saturday, which I used to do. But it turns out that drinking wine, a little bit of, we think the wine with the highest levels of the best for your heart is this Cananao out of Sardinia. But drinking it with a meal, this is just an interesting little side point. When you drink your wine with a meal, and if you're combining it with a Mediterranean diet, the reaction literally creates polyphenols, literally creates antioxidants that weren't there. So it's one of these 1 + 1 = 3. The longest lived people eat mostly plants. Doesn't mean they don't eat meat. In fact, they do. Almost every Blue Zone eats meat. But it's thought of as a condiment. It's not the main 12-ounce feature. It's the little thing off on the side here. It's eaten as for holidays, or it's eaten as a festive food. Portion about the size of a deck of cards. What you see over and over in the longest lived cultures, people eating beans, people eating fruits and vegetables, and then interestingly, nuts. We know that people who eat nuts, and this is a correlation, I can't explain it completely, but we know that people who eat nuts 4 times a week, 2 ounces a time, live 2 to 3 years longer than people who don't eat nuts. We don't know if there's something magical in nuts, oils, or if because you're eating nuts, you're therefore not eating salty snacks, but we know that works. And then little strategies to keep from overeating. Hara hachibu, that Confucian adage. Pre-plating your food. We know that people who eat a big breakfast actually consume fewer calories throughout the day than people who start their day with a breakfast bar and are on the go. And breakfast should be protein, carbohydrates, and yes, even fat. Fat will sustain you. And then the foundation upon which all of this rests, and which is largely overlooked, and in the most important quadrant here, is how we connect. Huge. We see people who live in the longest lived areas in the world, Blue Zones, put their family first. They invest in their families. And I don't mean being an ATM for your kids, but I do mean maybe knocking off after 8 hours a day and going home and spending that time with your kids. I think Roy's edict that he's going to be with his children on their birthday is incredibly powerful. It sends a message to children that I am taking care of you. And guess what? If they're imbued with that message when they're young, there's a better chance they're going to take care of you when you're older and thus impact your life expectancy. We know that the longest lived people belong to some faith-based community. Out of 253 people I interviewed, all but 5 belong to some faith. We know that if you belong to a faith-based community and show up, it doesn't matter if you're Jewish, Muslim, Christian, Buddhist, showing up 4 times a month is worth 4 to 14 extra years of life expectancy. That's research out of Duke, not Dan Buettner. And then finally, and I think if you remember one thing from this presentation, this last one is the most important. Build a tribe. Build the right tribe around you. We know that if your best friends are obese, there's a 50% better chance that you'll be overweight. If your friends smoke, it's more likely that you'll smoke. If your friends are unhappy, it's more likely you'll be unhappy. The longest lived people in the world never belonged to clubs. They didn't go down to the gym, but they either were born into or they proactively surrounded themselves with the right kind of people. And we're influenced by them for the long run. Because when it comes to longevity, there's no pill, there's no supplement, there's no diet program, there's nothing that works in the long run. But friends tend to be long-term adventures, so they can have that long-term impact. So, all right, I've just told you these 9 things. And I could probably get you really motivated, get you fired up, like 4th of July fireworks down at the riverside. But in 2 weeks, you'll go home and you'll forget them, for the most part. A few things might linger over time, but most of these things don't last forever. So the big question is, how do you get a population, how do you get a whole city, in fact, to incorporate these? The capacity of the human machine is about age 90, but life expectancy in this country is only 78. Somewhere along the way, we're leaving 12 years on the table. And people in the blue zones are getting those extra dozen years, the years we're missing. The average American has 3 years of morbidity, 3 disabled years at the end of our lives. Those years will spend about 95% of our healthcare dollars. People in the blue zones have less than 1 year of morbidity. They're not doing it from genes. They're doing it because of the way they live. A few small strategies. So we looked at this. We teamed up with the University of Minnesota School of Public Health. We then teamed up with AARP and got a big grant, and we spent the better part of a year hiring who we believe were the nation's top experts at helping us put this to work in people's lives. And about a year ago, right now, we launched the Vitality Project. My partner in this endeavor, Joel Spoonheim, and I sat down and we looked at the domains human beings live in. And we broke it down into 4 areas. There's our community, which I take to mean our physical environment, the neighborhoods we live in, the streets we live on, our access to recreation, ability to walk or bike places, our social network, our habitat, which I take to mean the structure in which we spend most of our waking hours. If we're an employee, it's our employer's structure. If we are a stay-at-home mom, it's our home. If it's a kid, it's the school. And then inner self, this speaks to purpose. And then, like I said, we hired the best people in the country who could help us change the environments or permanent or semi-permanent ways to affect these 4 domains. America's not new to public health initiatives. There have been dozens of them, and they typically spend millions and millions of dollars. There's a big one in the mid-'70s in Minnesota, in fact, spent $2 million to try to get a whole population to live longer and better. But what they did was focus on diet and exercise. Well, no diet in the history of the world has worked for more than 2% of the people in the long run. Exercise programs, people get all whipped up about them in January, but by September, 50 or 60% have dropped off of the exercise program. Nothing seems to be working for the long term. So our approach on this is how can we permanently change the environment, or at least semi-permanent, so that when my team leaves, these infrastructure changes, these policies are still there and live on. So focusing first on the community, we tried to find a community that would mirror the rest of America, that had rates of cardiovascular disease, cancer, and obesity that more or less reflected the rest of America. And we found a city called Albert Lea, 18,000 people, 65% of whom are obese or overweight. And then we first brought in Dan Buettner, been to 2,500 cities, who worked with the city planners. Albert Lea at the time was thinking about widening Main Street. Albert Lea has this beautiful downtown. People connect there, they go to the local cafes and they talk about daily events. They eat in the restaurants, they go down to the bars at night and connect after work. But they thought, no, economic prosperity will widen this street, will raise the speed limit, will bring more economic lifeblood in from the cities. Well, instead of doing that, we convinced them that, no, don't spend that money on widening the street. Think about the fabric of your society, fabric of your community. We got them to actually spend that money to connect sidewalks. They built 1.7 miles of sidewalks, and very strategically, instead of building whole new sidewalks, we simply connected the gaps. That way, if people wanted to walk to the store, walk to church, walk to their friend's house, instead of having to cut through traffic or cut across a field, there was at least now a commuter route. Just about any place they wanted to go. There's very good studies that show that if you make the active option, the easy option in towns, you boost physical activity by as much as 40% without trying to convince people to change their behaviors. You just provide the environment so better behaviors ensue. We knew from blue zones around the world that people who garden seem to be one of the things that correlate with longevity. So we convinced the city to create 7 new public gardens. And so everybody who lived in a high-rise or lived in a small house with no yard had access to a garden. We brought in Dr. Brian Wansink, whose expertise at the Cornell Food Lab is setting up kitchen environments so people are nudged into eating fewer calories and eating better foods. He helped us go into about 50% of all the employers in Albert Lea. There's 30 or so employers in Albert Lea, and fairly big ones, to optimize their environment so that employees would naturally eat better. We looked at vending machines and traded out all of the bad options for a few of the very good options. We noticed that the employees were going out to lunch every day at noon because this is the picture of the old lunchroom. It was great. Ooh, God, I almost ended my life there. It was gray and dismal. And we just convinced them to make the lunchroom a more appealing place to have lunch. Because if they weren't eating in the lunchroom, guess where they're going? They're going to the fast food burger place or the fast food pizza place. So we worked with made over their lunchroom and made over their menu, so at least there was a healthy option for lunch every day. So this project unfolded in 2 big phases. And the first phase was working with that physical environment to change the policies, find the best practices not only from blue zones but from America, and convince the civic leaders, convince the city government, convince schools, convince employers, restaurants, to make the environmental changes we were recommending. And that takes a while. That took us about 5 months. We think optimally it should take 10 months. But after 4 months, we then brought the entire town together. And the beauty of having a bit of a story of the world's longest lived people, it's aspirational. You can actually show people how centenarians around the world have reached 100 in a way that makes you look forward to being older. And we're very successful. Out of 18,000 people in Albert Lea, we got almost half of them engaged. We packed the biggest venue in town the night we launched this with the citizens of Albert Lea. We actually had to open up a second venue to get them all in. And what we asked them to do was really pretty simple. Again, we weren't trying to sell them some diet. We weren't trying to sell them some exercise program. We really weren't even asking them to change their behaviors. But what we did ask them to do were 3 things. Number 1, we asked them to take a longevity test developed in collaboration with the University of Minnesota School of Public Health. We call it the Vitality Compass, and it asks 35 questions. It uses CDC data and results of 350 studies to calculate not only life expectancy, but healthy life expectancy. This is what we really want, your biological age, and then it gives a half a dozen customized suggestions on how to get the years you might be missing. We wanted to make sure everybody takes their life expectancy at the beginning, because then at the end, we're going to want to take it again and see if our initiative actually worked. Then we asked them to take a pledge. And I remember the night we had them, I had a packed auditorium, and I gave them that Blue Zones presentation I just gave you. And then I said to them, now we're going to have a break. I'm going to ask you to do something that's going to take about 2 hours of your time and some engagement over the next 6 months. If this isn't right for you, I want you to quietly leave. But if you come back, you're in. And of course, 99% of the people came back, and I got them all to stand up, and I said, look at each other. You are the solution. In a sense, I was simply unleashing kind of a will in the town, but I was also getting them to sign a contract with each other as they looked at each other. They signed the pledge. We got about 2,500 adults signed the pledge. Many of them did it for their entire family, so it represents many more than 2,500. And we asked them to do simple things, like plant a garden. They'd be nudged into physical activity. Wear the Hara Hachibu bracelet to remind them. Again, this is sort of marketing. Keep it on your wrist for a long time. Nudge them into eating only 80%. We had a team of experts who went into people's homes and showed them how to deconvenience them so you burn an extra 100 calories a day or 150 calories a day without thinking about it. To go into their kitchen and arrange their refrigerators, arrange where they put their junk. Everybody's going to have junk food. I have junk food in my kitchen. But arrange it such that every time you walk in the kitchen, you're not confronted by a bag of chips, but instead a fruit bowl. We know that people who use 10-inch plates as opposed to 14-inch plates eat about 22% fewer calories at every meal. So we source plates citywide. People we just said, go get rid of those big 14, we'll get you a good deal on the 10-inch plates. Because we know, very good research shows, you'll eat less at every meal. Again, an insidious way to get them to eat less. Remember that little Okinawan technique of pre-plating the food at the counter and then bring it to the table? Well, Brian Wansing, he's actually a PhD from Stanford in food marketing. He helped us develop a counter sign that we got people. Part of the pledge was just to agree to display this sign on the counter to remind you, moms, to pre-plate the foods. We make about 253 food decisions every day. Turns out the biggest decision is not so much what you bring home from the grocery store, it's how you serve it to your kids. I know me, if I make breakfast for my kids and I have some organic yogurt and some lovely fruit and some oatmeal and some bacon and I put it all on the table, guess which platter disappears first? The bacon one. That's okay if kids have a piece of bacon now and again. But pre-plate the food. Put the one strip of bacon and then the other good foods on and serve it. Profound impact on how much they eat and the way they eat it. This just provided a way for them moms to remember to do that. And if you can nudge people into doing it for 5 weeks or 6 weeks, research shows, it becomes a habit. And if it becomes a habit, then you can start saying it impacts life expectancy. Taking a cue from those Okinawan ladies, we helped create moais. One night we got about 10% of the town to gather in 4 different locations. Ostensibly, we were asking them to join walking groups, but I said to them, you're not here to learn how to walk. You're not here to log miles. You're here to make new friends. And we demographically clustered people. We've done the research to know what type of people are most likely to make friends. Healthways has a great relationship with a behavioral scientist named Jim Prochaska. Prochaska's figured out we all live on a continuum of behavior when it comes to healthy behaviors. There are those people who are overweight, not healthy, and they're fine with it. And then there are those people who are unhealthy but motivated to change, and then there's the marathon runners or triathletes. The intervention for each of those 3 groups is completely different. Our objective with this walking moai was to get the unhealthy and some of the healthy people, but everyone was motivated. So we had 1,000 people who were motivated to change their healthy behaviors, and our goal was to make friendships, lasting friendships, because again, think about the people you hang out with. A lot of them have been friends for years or decades. So we were creating new friends. We got them to walk together and to volunteer together for 10 weeks. And then finally, in the fourth part of that little bottom of the triangle, the purpose part. Now, I would guess most people in this room have a pretty good idea what gets them out of bed in the morning. But you go to rural Minnesota, and there are a lot of people working in factories. There are a lot of people who are farmers who haven't done really much in the way of internal inventory. And we brought in who we thought was one of the nation's top expert at helping people do that internal inventory to identify their sense of purpose. And we offered it free to everybody who pledged in Albert Lea. And this took place over the course of about 6 months. You didn't have to do it all in one night. But the idea here was to connect them in such a way and then give them a few sort of leading words that help them identify their passions, their values, very important to know first, and then identify their gifts. Now, it's one thing to know where that cross-section of passion and talents lie, but then you need to find an outlet for it. So my partner on this project, Joel Spoonheim, went to all of the volunteer organizations in town. Imagine if this were a purpose workshop, and as soon as you've been newly imbued with your sense of purpose or your gifts, 90 seconds at a time, the Battered Women's Shelter stands up, and the Humane Society and the Salvation Army, each of which saying, we need people like this. So right then and there, we were able to increase volunteerism. We know that this project generated over 2,500 hours of volunteering as a way to activate this purpose. One thing to talk about it, but actually show people how to find it was an important component to this. So we pulled together some hard measurements from this Vitality Project over the 10-month period. We had about 3,400 participants. This is very high for a public health initiative, 24% of the population. Got 700 people to create new friendships in the Moai. They took over 75 million steps. 51% of all the employers signed on. And again, we were signing them on for an environmental change. One company reported a drop in absenteeism by 20%. We got most of the grocery stores to participate, 64% sales gain in the right longevity foods, so we know we were impacting what people ate. Their average life expectancy went up by over 3 years. We didn't try to do this, but the nice byproduct is people lost weight. We know that there was higher vegetable consumption, physical activity, and this is important. This gets to this idea of well-being. Lower reported feelings of stress and sadness. So people themselves were telling us that their well-being was higher. And finally, and we think this is the most important measurement of all, we had a 49% drop in city workers' health care costs as reported to Blue Cross and Blue Shield. Very hard numbers. So I think this is among the people who pledged. We also have done a survey and found out that the healthy behaviors, the awareness of healthy behaviors has gone up even for those who did not specifically pledge, so that there was this sort of ripple effect. So Joel and I have spent some time to think about, and we've been asked, why did it work in Albert Lea? And there are 3 answers. Number one, we created, or the community itself created, an omnipresence of health. You couldn't go anywhere without bumping into blue zones. Your city government was doing it. It was in the grocery stores. Your employees were doing it. Your kids were bringing it home from school. There was a perfect storm of influence. You could not escape this idea of environmental change that favors longevity. Number 2, it really wasn't us. We unlocked internal will in that city. Do you think 65% of the people, or anywhere in America, like being overweight or obese? No. If you can show them an easy way to not be like that, to make a small investment up front that they'll live in, that will live on. And then finally, the thing, and I think the most important thing that made it work, was the leadership in that community. There was a leadership that could work together. The employers could work with city government, could work with civic organizations, even working with the religious organizations. Now, I'm new to Nashville, but I'll tell you what, to come into a room at 8 o'clock on a school day and see it filled with civic leaders and academics and business leaders suggests to me strongly that Nashville could be the next blue zone. Thank you very much.
At this time, it's my pleasure to introduce the next segment of our program, Stories of Community Makeovers. We are going to hear from Jake Glover, Director of Health and Wellness Initiatives at the American Health Insurance Plans, AHIP. And he has generated a lot of buzz for his organization's wellness and fitness programs, which have been extremely effective in a variety of settings. School districts, municipalities, some Fortune 500 companies, and I even learned this morning the NBA as well as the NFL have also tapped his expertise in terms of developing some programs for them as well. With him will be John Stevens, Superintendent of the Grundy Center Health District, Grundy Center, Iowa, and Dr. Elaine Ignico, Coordinator of Physical Education, Teacher Education, Ball State University, Muncie, Indiana. Both of these individuals have been working hard and achieving success in transforming and improving the health of their local communities in some very interesting ways. Please join me now in introducing them to the stage.
All right, so I know what you're all thinking. You're thinking, sure, this event was able to draw public officials, famous authors, business leaders, but how in the heck were they able to get Jake Glover? So, I say that, I joke, because I don't have the esteemed resume of all of the people that I've shared the stage with today and will share the stage, but I do have a unique experience, a unique perspective on community transformations. I have worked with about 42 state and federal grants over the last 3 to 4 years, and have personally written 14 large federal grants, some with great success, some with challenges that we have been able to learn from so that we can take those lessons and help communities like Nashville and other communities all over the country learn and make sure they don't fall victim to the same pitfalls that will get well-intentioned ideas that fall short in the delivery mechanisms that allow them to actually make change. Because remember, at the end of the day, what I'll speak to specifically are school transformations. At the end of the day, all of you are able to sit for hours and listen to speakers because you're engaged by the content and the curriculum. If you had been a group of middle school students, you all would be passing notes at this point. You all would be walking out of the room. You'd be completely disinterested by the third speaking panel coming up to speak. So there is a way to engage students that comes, even as we talked earlier about no food in the halls, no food in the classrooms. There is a management style that has to come with that in order to even make that possible. So what I'm going to do today is tell a story of Grundy Center Community Schools and have my speakers come up and tell their personal examples of how they've been able to work in their community to make a lot of these examples come to life with real practical solutions. So what I'll do now is start a little video that keeps me on time so that I make sure I get to the points that I need. This is the playlist for community transformation. And what I want you to remember is that every passing moment is the next opportunity to turn it all around. I will be 30 years old at the end of this month. So I have seen the 80s, 90s, and the 2000s, the decades at which every single year you've been told that childhood obesity and general obesity are on the rise. And that if we are a country that's reporting statistics but has not yet found the solutions that will move us to the next level of change. So what I want, there we go, even bigger. So what I want you all to remember is that no matter what we do today, no matter how inspired you become, if you don't have the action steps that are real and measurable, nothing will come from it. But if you do, if you take the 3 big playlists that are important, and that's design, implementation, and evaluation, the 3 big key pieces of a community transformation, and within each of those, the songs that make those playlists of design, curriculum, content, and progression, so that everything is developmentally appropriate from elementary school all the way to the exit strategy at the end of high school, so that they learn something each day. Implementation, so that there are defined responsibilities for the teachers and the students. The use of graduate students and interns for cheap labor and the ability to deploy content quickly. And community interaction, which we've talked about some today, but we're going to really talk about what that means. And then the evaluation piece. so that every day our students in Grundy Center have to get 30 minutes in their target heart rate zone on a downloadable heart rate monitor to measure their physical activity. Our teachers are held so that they have to get a certain percentage of those students in their zone, or they have to modify their curriculum. And the institution as a whole is evaluated as whether or not they're meeting the goals, the grant, and the funding that they were given to actually change the way students are motivated to be physically active. So what I'm going to start with to get you motivated and get you moving, if I could even get that on the loudspeaker, can you? So hold on, this is one of my favorite parts. So what I'm going to do, as I even tee this up, my muscle wrap, I was challenged by some of my students in my elementary school in Grundy Center, Iowa, that they were not interested. I came in the first day. I'm an exercise scientist by trade, and I work with NFL teams, NBA teams, teach them muscles, joint actions, the way to use this. And I told this to a group of kindergartners, and by the end of it, half of them were picking their nose, several of them were completely disinterested. And I asked afterwards a child named Zach Delfs, what would have made you more interested in my lesson? And he said, Mr. Glover, if you sing to me. And I was like, sing? He said, yeah, you know, A, B, C, D, E, F, G, you sing, you get me, right? So I went back, and for about 2 days, I wrote every muscle and joint action in the body into a muscle rap, which we taught to the high school, that then trickled down to the elementary school. So by the time these children heard 3 weeks of the same rap, they knew muscles and joint actions of the body. So here we go. Muscles and joint actions of the body by Jay Glover. So follow along with what I'm saying, and note how each one of these little pieces to then be taught in a lesson, so it's easy to deploy this content across all age groups. So follow my lead. Here we go. So it's M-U-S-C-L-E. You'll learn those muscles if you rap with me. On the front of your arm is where you'll find your bicep, but the back of your arm, find your tricep. Bicep flexion lets you touch your nose, but tricep extension, touch your toes. I said right above your hips, but below your chest. Erects abdominis helps you with your sit-up test. Ask any ballerina, and I bet she knows your gastrocnemius help you get up on your toes. Now that same ballerina that's up on her toes, plantar flexion allowed her to go. Now dorsiflexion is when you point your toes to heaven like the clock, tibia 2, toes at 11. Abduction's the process away from the body, but remember when you kick, not to hurt anybody, huh? Adduction brings you back in line. Think of closing scissors, you'll do just fine. Pronation's the process when your palm is down. Think of chilling in the car and rolling through town, but when you roll your palm up, you supinate. Same basic principle as holding a plate. Now, using your muscles helps to keep you strong. So keep yourself healthy and you can't go wrong. Bow, and you're done, right? So ladies and gentlemen, the point of that is even elementary school students can be introduced to these concepts the same way that professional athletes are. It's just finding strategies. You all know teaching strategies if you're in education, and those are so important to getting the message across. And if you're able to get to a child, if you're able to get to an individual before something catastrophic happens, you have won. My hope is that we realize that if we take the messages that all of us are saying today and we turn inspiration into deployable strategies, my son, when he's 11 and 30, will not ever even think of obesity as an issue. He will think that the American child is a healthy, active, responsible, understands nutrition, and this is what leads me to this. This is the beginning of the Grundy Center transformation piece. I was recruited because of that story, and every day all of our students wear a downloadable heart rate monitor with a really well-sequenced order to get their heart rate monitor on. Graduate students download it every day, and students are held accountable to 30 minutes in their zone for every single unit. And teachers are held accountable to make sure that they are able to get their students in their zone. When our children are playing basketball, they're wearing Bluetooth monitors that send their live data up to the wall so that the coaches and the students are able to monitor their heart rate response during physical activity to make sure they're safe and motivated. At the end of the day, whether you do rollerblading, whether you do anything, the content and the deployment of the curriculum is just as essential as the idea itself. Teaching students and teaching parents and teaching the community activities that allow them to exist in a world in which you don't have fitness centers, as we've talked about, daily activities, but then reinforcing those messages that exact night and having all the community members eligible to do the exact same type of activity so that parents talk to their children and children talk to their parents and their message is reinforced is how you win. So, you know, we've talked already about giving these opportunities to the community, but it takes getting an organized group exercise schedule, making sure that parents understand what they're doing so that everybody's saying the same thing. something I was going to do if Dan hadn't gotten everybody to stand up is get you up and active. One of the biggest things that you're going to need to do in your physical education programs is get teachers to get away from static stretching at the beginning of activity to dynamic warm-ups. If those are new terms to you, talk to me offline, but what we've done when we see physical education programs is most of them spend the first 10 minutes of class stretching to get ready for physical activity instead of doing dynamic movement, which NFL and professional teams have been doing for years, as the best way to prepare them for activity and a way to get them in their target heart rate zone from the first minute of class to the end. Then we don't only just say this helps improve flexibility, because that should be your question, is what if they're not as flexible? We measure everything that we do with a sophisticated evaluation system where that computer program you saw measures flexibility. We do core training to make sure that they improve the strength of their core. Programs all over the country right now test core strength. You did a sit-up test when you were a child, I did a sit-up test, but so often sit-up tests are done at the pre-test and the post-test evaluation, and there's no content in between to actually improve their core strength. And it's not to tell children to do sit-ups, it's to give them a different technique every day that it gets them motivated, just like all of you. If every day I told you do sit-ups, that will improve your core strength. You would get bored and you would quit. If you do medicine ball work on Monday, body weight conditioning movements on Tuesday, hanging movements on Wednesday, oblique movements on Thursday, it just gives you a lot more things to get you excited, which leads to this is one of my favorite images. Treadmills are a part of every grant that I've written. So often we get treadmills and children are told, run on a treadmill. And children are like, I am not a hamster. I don't just like to run on a wheel. You know? So what you do is you create strategies and you teach them lessons that allow them to do other things on treadmills besides run. My kid, this is something I stole right out of my NFL team playbook, and they absolutely adore it. And even though I have juniors and seniors in this image, I've done this. There's a sequence in the way you teach lessons so that elementary school students can do the same thing. Day 1, they'll go crazy, and you should inspire them to have fun. Day 5, day 6, day 7, day 23, you have to make sure that all different types of learners, visual learners, are given visual cues on the best way to row by that fantastic example on the wall. You know, auditory learners are given auditory cues. Kinesthetic learners are given kinesthetic cues. Then you develop challenges. The first one to get 1,000 meters in X time. You post the record holders on the wall. You make sure that if you have an idea, it doesn't just exist as a rower that you throw in a gym and expect kids to get and stay engaged, because they won't. Children will only get engaged and stay engaged as long as you add a new wrinkle. Last piece, cup stacking. Cup stacking, if you've never heard of it, is the foundation of many physical education programs all over the country, but also vilified as one of the problems in physical education, because typically kids stand there, they stack the cups, they break them back down. That's play, but it won't do anything to reduce childhood obesity. But in Grundy Center, we want to do cup stacking, but we had to adhere to our 30 minutes in their zone, so this is the way we do cup stacking. All of our students are still able to meet their 30-minute standard because of the way we design the curriculum. It's not the lesson, it's the way you deploy the lesson. As a result, Secretary of Education Arnie Duncan came out to Grundy Center to see the program and recognize it as the model for physical education programs. And while Secretary of Education Arnie Duncan is one of my heroes, this is the man that I'm asked to come up to the stage now, has been a mentor to me for a long time, because he really embodies the spirit of this community. Superintendent John Stevens was one of my favorite pieces of this community, because every single week I did a boxing program on Sundays that was open to all students, all parents of students, and Mr. Stevens was there every Sunday beating me up, allowing me to beat him up, and representing to all of the kids and the parents of that community that he believes it, not just as something that he says on a podium, but every day that's the only way he knows to get to be one of the Blue Zones. So, Mr. Stevens, come on up and tell a story.
I am lathered up. Thank you, Roy. 8 years ago, this is deja vu for me. 8 years ago, my little community, Grundy Center, got together and had the right people on the bus, just like we have today. The difference is Grundy Center is a small community. I think we had maybe 45 people on the bus. But we had a good ride. And over the last 8 years, we've done some tremendous things, if I may be so bold. And today, I only have a few minutes, but I'm just going to give you the tip of the iceberg, so to speak. And I hope that when I'm done today, a couple of you will say, hey, I want to talk more to people at Grundy Center. So I'm inviting that right now. When I'm done, we'd love to have you get in contact with us, Google us, find out more about us. A few weeks ago, I was in Washington, D.C. I was the only educator invited to sit on a panel to review the Commission to Build a Healthy America, to review their recommendations. They had 10. And the really cool part for me, being an educator, was 3 of the 10 recommendations had to do with K-12 education. K-12 education. The first one was, you need to make sure that your students are in a quality PE program and active every day up to 60 minutes. 2, you need to remove all the unhealthy foods and beverages. And 3, you need to step outside the K-12 walls and connect with higher education, corporate America, and community. So we've been doing that for 8 years, and that's how I met Mr. Glover. I'm going to walk you through some slides. It's going to be very quick. Beth Kirkpatrick. Beth Kirkpatrick is from Grundy Center, Iowa. She's called the rock star of PE in America. In 1980, she was Iowa PE Teacher of the Year. She became National PE Teacher of the Year. She's the one who took technology, the polar heart rate monitors, and said, you know, we should do this in my PE class. Rick Shoebox in the lower picture. Rick has been at Grundy Center for almost 20 years. He's the mentee. Beth lived in Grundy Center, but lived in Vinton, Iowa, drove 75 miles every day. Rick has been learning from her, and he's the one who brought heart rate monitors to Grundy Center almost 2 decades ago. They say that new innovation takes 30 years to become common practice. Our time has come. 1980, 2010, do the math. If you're not using heart rate monitors in your schools, how many of you in here are educators? Yeah, that's my point. Got a couple. You need to get back to your schools and have that conversation. This slide simply shows what we do is put heart rate monitors on kids years ago and had them wear it all day long, then come back and download, and this is what you get. You take PE out of the curriculum, you have a sedentary lifestyle. Pretty dramatic. Every day starts out in PE, strapping up. Takes about 1 minute. We start in 4th grade through 12th grade. As Jake mentioned, it holds the kids accountable. More importantly for me, Superintendent, it holds the teachers accountable to make sure the kids are getting what they deserve. Jake talked about the lesson design. We make sure that within our lesson design, grades 4 through 12, that the kids are active and they're in what we call the healthy heart zone. They're supposed to be in the healthy heart zone. Because of technology, we have printouts. In God we trust, all others bring data. Hey, our PE department just blows it out of the water. We have the best data of the 20 content areas being taught at Grundy Center. The best data comes from our PE department. There's a class summary, and you can see in the zone, 71% of the kids in the class in the zone. Above the zone, 11.4. So about 85% of the kids in class are in their healthy heart zone. What about your kids? Do you know? Are they exercising that most valuable muscle in their body appropriately? We have all types of reports that we can generate. I'm only talking about the heart rate monitors today to you, but we have all types of technology that we utilize, and it motivates kids and it motivates teachers to give them a report card on their fitness. We have the visual evidence. You know, there's a term, I think we might have come up with it. It's called exercise abuse. You know that every year hundreds of kids drop dead in high school? Are you aware of that? And every year hundreds of people in the military going through basic training drop dead? They keep it pretty quiet, but it's exercise abuse. We need to be putting heart rate monitors on our athletes and on our young people who are training for war. Cardio testing. This student has no idea what his heart rate is. 90-some% of the schools. This student does know and can be responsible They can learn at age 9 or 10 how to pace themselves and stay in their zone. Very important skill. What we do is we reach outside the school walls and we go to the community. And what we found in Grundy Center 8 years ago is when we got the heads together and got lathered up, we did find purpose, and we decided that, you know, the most important thing in life is to have happiness and be healthy. And so that's number one for us. It's even more important than math, reading, and science, believe it or not. So when you look at this picture, you're going to see that within our fitness center, before, after schools, weekends, we have intergenerational happening going on. We have an 80-year-old person in that top middle slide, and she's in the room at the same time I have 6th graders, exercising, talking, sharing their data. It's very motivational. At first, it was very scary. People don't like to go to fitness centers, let alone have somebody watch them. What we did to get the community involved, and you might want to try this, is how many of you have worn heart rate monitors before when you train? Good. That's great. Quite a few. What we do is we just pass out a whole bunch of heart rate monitors, and we have people wear them for a day and come back and download them. And then we share the data. And when you look at all these professions and you have the dialogue, you find out that most people are sedentary. The only people that I see who are getting exercise have a planned time. They make time for the exercise, and it shows. And then all the things that Dan's been talking about become true when you make time to exercise and do it right. This is an example of what's going to happen in a couple weeks. 8 years ago, we got the community together. They decided that the school would be in charge of diet and activity, and that the community would be in charge of everything else that deals with wellness, so it's comprehensive. So this is a gymnasium, for God's sakes, in a small community. The second Saturday of January, we always have a health fair. Believe it or not, a lot of people show up, probably over 20% of town, and they walk through all these booths, and they get support on how to become healthier. Grundy Center became the first in America P for Life Institute. I don't know if you're familiar with P for Life. It's a nonprofit to promote best practice in physical education. We're the first elementary center in the United States. P for Life right now I think is in 38 states. If you don't have P for Life in your state, I didn't check it out, that's something you might want to make a phone call to, is corporate headquarters in Kansas City. A different kind of PE. The old model, if your school, if your kids, if your grandkids are going to a school where they don't have daily PE, shame on you. If they're going to a school that just throws the ball out and plays the old sports model, shame on them, because that's not going to get the job done. You need an active lifestyle model. That's part of what Jake was talking about. The activities need to be the types of activities you can do your entire life. You don't play sports after high school unless you're that 2%. Here's a P for Life core values, directed to all students, not just the athletically inclined. Variety of sports and fitness activities, provide a safe and encouraging learning environment, incorporate the technology, individualize fitness assessments, and extend beyond the walls. Those are the types of things you need to be doing. Another shot of our kids rowing, doing the Dance Dance Revolution. Changing our ways. I had 2 teachers 8 years ago, before we started the Scholar program where Jake came to our school as a graduate student. I had 2 teachers. We were going to do a PE makeover. I said, you're going to learn how to deliver instruction differently. I know you've been doing this 20+ years. I understand. We're going to give you 1 year to change your ways. Change does not come easy. I was a new superintendent. Do you think that they believed me? They had tenure. Guess what? They lost their job in March. They were moved out. We brought in new people. So we're that passionate about it. So the revolution had begun. You're talking about transformation. We're talking about transformation. You take the lessons of 1980, you plug them in, you learn your lessons. These 2 teachers, over the course of the last 6 years, have worked with 42 graduate level people. And now those 42 people are out in the world making a difference. teaching other teachers, teaching other peers within their school districts to do it differently. The old day of just having a whistle, you know, there are a lot of people who still graduate from college, teacher prep for PE, and all they have is a whistle. They need a lot more than that. The toolkit is totally different once you jump into the technology world. So here's the unique partnerships that we've formed in the last 8 years. University of Northern Iowa, top left, 20 miles down the road. They offer a graduate level program, an immersion model in Grundy Center, Iowa, the only one of its kind in America. Basically debunks the idea of theory to practice. It's more practice linked to theory. Where people come to our school, we screen, we get the very best graduates in PE. They come to our school, they teach half-time all year long and earn their master's degree in 1 year. Pretty amazing, and guess what? They're free to our school district. But they work really hard. Jake, you know, I think he aged about 5 years in that 1 year. And it wasn't just from this little body beating on him in boxing. Then you have Polar Electro, they've been our partner. They pay a stipend to these students who come to our school. We give them in-state tuition, Polar pays a stipend, the incentive is there. And then P for Life is our third partner. This is just a shot of some of our master teachers working with our Polar Scholars. Components, as I've said, contextually based, totally immersed. Those are the types of things we're offering, which I think are unique to our school, but sadly they should not be unique to our school. So, you can stay where you're at, or you can choose a new way. It takes courage. You're going to need to go back to your school boards and your teachers and have that conversation. Guess what? Teachers won't do it on their own. The pressure needs to be applied. These are some of our past scholars. We started with this graduating class in '04. The girl at the top of the pyramid now is a doctor, professor, and she's changing the undergraduate programs in her university, West Virginia. Here we are, one of my buddies here today, one of my new buddies was talking about Dyersville, right, Jim? So we're coming out of the corn here, making fun of Iowa, discovering new world out there. One of the young man in the middle is one of our teachers. He replaced one of the individuals that we said goodbye to. There's Jake at the end. Talk about living many lives and being healthy throughout all of our lifetime. Jake, I think, is in a police outfit there. I'm not really sure what that means. He's scary enough. Take a look at the tractor. There's meaning behind this picture. Can you imagine farming with the old equipment 30 years ago? Today? No, these tractors are quite something, GPS driven. You need to take a look at your PE program, your health programs in your schools. I bet they're a lot like when you were in school. They need to change. If you take a look, our Polar Scholars come from all over the country. We've only had a handful come from Iowa, as far away as Hawaii. We call that a bumper crop there. This picture of Jake working out with a student. And again here, it's all about relationships. Our teachers are great role models, and they have great relationships with the kids. So, when you look at what's going on in your school district, I would suggest to you, PE's always been the lowest rung on the ladder. Part of your challenge is to go back, convince people that it needs to go up the ladder. If you really truly value health and well-being of the kids, then you need to value your PE program enough to fund it and help fund it. You're going to have to go out and get sponsorships because schools don't have a lot of money. And then you get it where it needs to be. So physical education, seen as a bridge, or could be a relic of the past. In most schools, we're losing our PE programs. I thank you very much.
This has been a presentation of the Nashville Health Care Council and Nashville Public Television.